Welcome back to Women's Health Weekly, brought to you by the experts in women's healthcare at Maiden Lane Medical. Please subscribe to our YouTube channel and please go ahead and visit our podcast, which is available on Apple Podcasts and Spotify, and there's some Google Podcasts. There are about 10 other platforms that have picked up our podcast, and we're really excited to be able to offer that information on a podcast as well. So I am very happy to bring one of our other physicians and gynecologic surgeons here on the weekly program with us. And I know you've all met her before. Some of you may be her patients. You've all met Dr. Shoma Datta. Dr. Datta has been with the practice for many years and is an expert in minimally invasive surgery, gynecology, and has a particular interest in fibroids. So let's start with the basics. What on earth is what's Levy even talking about? What is a fibroid?
So essentially what a fibroid is, if you think about the uterus, it's basically a large, very muscular structure for the purposes of pregnancy and going on to delivery. What the fibroid is, it's a benign tumor, number one, meaning not a cancer, but it is an overgrowth of some cells, and it's an overgrowth of muscular tissue within the uterus. And it can be on several aspects of the uterus. It can be, and this is very important, you'll notice down the road when we talk about treatment, it can be sitting on top of the fibroid, it can be at different depths within the wall of the fibroid, and it can even be impinging on that inner part of the cavity where you typically would carry a pregnancy. So location is very important, and that's the gist of what exactly a fibroid is, because a lot of women actually, a lot of patients say, oh, I saw on my sonogram, or somebody told me in the past I had fibroids, but what exactly is it? So that's a good kind of basic explanation.
How does a woman know if she has fibroids? What are the signs or the symptoms that a patient might start complaining about when there might possibly be fibroids?
So typically what we see in the office, most commonly women come in and they're noticed heavier periods, heavy bleeding outside the time of the period, or random spotting, just anything outside of the normal pattern of a monthly period. And in addition, they may have a number of other symptoms as well. One of them related to bulk symptoms. So because there is now this, tumor of any different size, but it could be putting pressure on the bladder, pelvic pressure in general, maybe with intercourse feeling extra pressure. So there could be some pressure pain that way, could be extra cramping feeling. And then in general, a lot of women say, all of a sudden, another thing can be bladder pressure. I feel like I have to, run to the bathroom to empty my bladder much more often than before. There's even, sometimes it can put compression on the rectum. So maybe difficulty passing a bowel movement, or, feeling that constant pressure. Those are what we most commonly see. Sometimes farther down the road, they may come in and say, you know what, my doctor told me I'm anemic. My blood count is very low, and we're looking for reasons why. And I've noticed my periods are heavy. So does that have something to do with it? It really has a pretty big spectrum of symptoms that we see. But I would say irregular bleeding is probably the first thing that we notice.
Let me get to the C word. The C word, the cancer word, can fibroids be, you said fibroids are benign tumors. Can fibroids be cancer?
So when we're talking about an existing fibroid, it is extremely rare that we're dealing with something. The concern oftentimes that my patients will have is this something that can become cancer? And the answer is it's extremely rare, almost approaching less than 0.5%, that something that exists will have a cancerous transformation.
All right, so let's talk about preventing fibroids, how they grow. Can fibroids even be prevented? Is there anything someone can do to prevent fibroids?
Typically, at this point, we don't have a lot of great preventive methods. There is some, loose data on low fat diet. And again, we do see that, the fibroid is hormone dependent, like we mentioned. So there is some thought about, can something be accelerated with hormone supplementation or medication? But there's not really a standard practice that we can offer to completely prevent fibroids across the board.